Hello guys, it's Unit 3 Part J.
Hello guys, today's topic is antenatal care. What is antenatal care? Antenatal care is a care that is provided to the antenatal mother. Well, the antenatal period is nothing but it is the period of pregnancy, that is from the date of conception, that is from the date of the pregnancy till the date of delivery. This period is known as antenatal period, and antenatal care is the care which is provided to those women who are pregnant. And this antenatal care is also known as prenatal care. Now, the objectives of antenatal care. Objectives are nothing but the aims and the goals of the antenatal care. The main aim is nothing but to promote the health of the mother and the fetus. Now, let's see what are the objectives. First, to assist the health status of the mother and fetus. The very first thing is when the mother come for a checkup, we will see whether the mother is healthy or not. If we come to know the mother is not healthy, if the mother has any kind of illness, then we need to promote and maintain the health status. Next, regular screening should be done. Regularly we should screen whether the fetus heartbeat is normal or not, whether the fetal movement is normal or not. So we need to keep on screening regularly at the regular checkups, and if we find any kind of illness, we need to prevent it and treat it before it gets complicated. Next, we need to orient the mother with physiological of pregnancy and labor. That is, month after month, the mother's body will be changing. The womb will be getting bigger and bigger, and because of that, mother will be feeling very insecure. She will lose her self-estimate. To regain that, we need to encourage her. To regain it, we need to educate her about the physiological changes that occurs during the pregnancy and during the labor. But when you orient, there may be anxiety and fear in the mother. We can find it. If we find it, we need to reduce it. We need to remove it by educating the mother. We need to provide an psychological support by which the mother will be able to regain her confidence. Next, by performing all those actions, we will be able to reduce the mother and infant morbidity and mortality rate. What is morbidity and mortality rate? That is nothing but death and disease rate. We need to discuss with the patient about the time, place and mode of delivery. That is nothing but when the patient comes to hospital, we will come to know LMP. What is LMP? That is nothing but last menstrual period. So when was her last menstrual occurs? By that we will come to know the EDD. What is EDD? Expected delivery date. By LMP, we will come to know when the delivery might occur. We will inform that to the patient and the couple. By that, they will come to know the time, place and mode of delivery. Motivate the couple about the need of family planning. Family planning, we need to motivate them, and most importantly, we need to motivate them for spacing. Spacing is nothing but there should be at least 2 years of distance between two children. Like if the first child was born in 2000, then the next child should be born at 2002. There should be 2 years difference. That is spacing, and that should be motivated. We need to provide education about it. And we have to inform the patient, the mother, to come regularly for the checkup. And the main checkups are at the 10th week, 18th week, 24th week, 30th week and 36th week. These are the 5 main checkups that are present in antenatal care. Questions will be provided at the end of the chapter. Until then, stay tuned. Meet you in the next video.